Hello everyone, this is Chadi Alraies from NCVH 2023 at New Orleans. I'm really privileged today to be with Dr. Britton Eaves to talk about the NCVH regional initiative for education and teaching. Thank you for being with us, Dr.
Thank you for having me. I've been doing this, I guess about 14 or 15 years,
Wow.
Fortunate enough to do it. We were actually one of the first regional conferences that Dr. Walker started.
Nice.
And we're up in Shreveport, North Louisiana. So it's been a great experience, for sure.
So now, with the education, as you know, you're a busy practice, right? And this is something we give you credit for on your team. Busy practice, and yet you have to put a program together, education. So what is the ultimate goal from putting these programs together?
Well, multiple goals. Obviously, education is first and foremost, but also I think what it also provides is there's a lot of people doing this type of work in multidisciplinary fields, like for example with PAD, you've got doctors, you've got wound care specialists, you've got podiatrists, you've got vascular surgeons and so forth. And not only does it allow education, but it also gives a chance to some fellowship, some camaraderie to really see what your colleagues are doing in the field, because as you say, you're busy with your own practice.
Yeah.
And so it's just like this conference, whenever I leave here, I feel re-energized and excited about doing the work again.
Yeah. And one thing we have to give credit for these meetings also, we noticed that there's not too much attention to PAD at a national level from like other conferences. I'm not going to mention names, but it's less attention, but this is having this focus kind of hands-on with multidisciplinary, as you mentioned. It's like we have shock team for the heart, we have a STEMI meet for the heart, we have stroke team, we have now PERT for the PE.
That's right.
But we don't have PAD team.
Yeah, you're right about that. But I mean, this conference has always been just such a wonderful experience. And how many local conferences are affiliated with this now? It's a pretty good number. I think it's like 20 something.
20.
Yeah, so I mean,
national and then some international.
I mean, they're local, right? But I think Dr. Walker and the NCVH team in general has done a really good job of spreading that out all over the country.
Making awareness of the process. So, how about the audience? Are you targeting fellows, physician, PAs, NPs, techs, nurses?
You know, obviously the way to have a successful conference is to have a lot of attendees. So we're happy to have anybody attend. But we usually have a pretty good mix. You know, in Shreveport we have a medical school, and so we have sometimes medical students. We had medical students this year. We're trying to begin an opportunity to have abstract presentations by some of the fellows and students and things like that. And actually this year, as my co-chair, I've partnered with Dr. Chadwick Burt, who he's head of vascular surgery at LSU, and he's also a very gifted endovascular operator as well. So that really gave an extra dimension. So I'm excited about that.
Yeah. Well, thank you so much for all you're doing.
Thank you for having me.
NCVH and for the education and the mission. Please watch its videos and others on the NCVH YouTube channel. This is Chadi Alraies from New Orleans. Thank you so much.
Thank you.
Thank you.
Bye-bye.
Awesome.
All right.